So welcome everybody and welcome to our reasonable suspicion seminar. I have historically done these seminars quite frequently. This will be one of the first times I'm doing this seminar via social media. So I hope you'll tolerate some hiccups as we go. My chair squeaks, so you may occasionally hear that. But as we go through the presentation, if you have any questions, comments, concerns, complaints, criticisms, witticism, thoughts, or thought disorders you'd like to share, feel free to do so. We are happy to entertain any questions. The second half of the presentation will be led by Lucy Manos, the Vice President of Operations for ScreenSafe. Lucy is somewhat of a savant when it comes to drug testing issues and drug testing experiences. So she'll talk about some of the questions that we received as we prepared for this seminar. So um, I hope that this is useful to you, and please, again, as I mentioned, any questions you have, please just put them into the chat, and the folks at CAM will help us make sure we respond to those as time permits. All right. So ScreenSafe was founded in 2000, 23 years ago. We manage all aspects of any organization's drug-free workplace program. We work with clients in literally every industry, including the construction trades, financial services, and healthcare, and grocery stores, and literally any kind of organization you can imagine. For many organizations, we're involved in the pre-employment process, coordinating pre-employment drug testing, physicals, and human performance evaluations. We manage random testing programs, return to duty after a previous positive, as well as follow-up testing for employees who have returned to work after a non-negative drug or alcohol test. Several organizations turn to ScreenSafe when they are confronted with an employee who they believe may be impaired by the use of alcohol or drugs, or who therefore may not be in a condition where they can safely and effectively perform their duties. It's our goal at ScreenSafe to lift the administrative burden of a comprehensive and effective drug-free workplace program from the employer, provide extra support and assistance. We all know that the workplace is negatively impacted by the misuse and the abuse of legal and illegal substances. For most people, substance use is an occasional issue and doesn't affect their workplace behavior and workplace performance. When an employee's use of drugs or alcohol affects their work, it has become a problem. And I think we've all seen the incidence of alcohol use and drug use increase dramatically over the course of COVID. I read an article that was published in one of the medical journals over the weekend where they talked about the number of people reporting drinking and using marijuana during the workday when they're working remotely has gone up dramatically. So this is a challenge that we're all confronting. Because employers have an obligation to provide a safe workplace, it's important that they actively promote their employee or members assistance programs so that people who recognize that they may have a problem are reminded that they have resources for assistance and support. In addition, employers must train their managers and supervisors to actively intervene when they have reasonable suspicion that an employee is impaired at work. Reasonable suspicion is a legal standard used in workplace drug testing that requires objective and specific evidence that an employee seems to be under the influence of drugs or alcohol while on the job or at the work site. So in this session, we'll list some of the signs and symptoms associated with drug and alcohol misuse and abuse. We've condensed those down to, I think, 4 or 5 slides where we talk about the signs and symptoms of impairment. And then we talk about the signs and symptoms of hangover. And then we talk about the signs and symptoms of withdrawal. And instead of going through all of the drugs, we consolidated it to that for the purpose of our time limit here. We'll discuss the importance of documentation that is clear, concise, and based only on observations. And we'll talk about how to prepare for an effective confrontation and referral for a reasonable suspicion drug or alcohol test. Finally, we'll review the important procedures and protocols regarding reasonable suspicion testing. We've incorporated into this program some of our documentation forms and our reasonable suspicion checklist. Those forms are available. Most of those forms are available on our website. So reasonable suspicion, the last thing I want to say about reasonable suspicion testing is that it is an emotionally and operationally challenging for the manager who has to request a test and for the employee who is subject to testing. Policies, procedures, and protocols should be clear, concise, and actively communicated to all of the people in leadership so that they are comfortable doing this and to mitigate the strain of an already stressful process. Um, Let me start by saying, so I want to make it clear, I am not an attorney. My comments here in this presentation do not constitute legal advice. My comments are based on 30 plus years of experience in the addictions field and alcohol and with drug and alcohol testing. I am a licensed clinical professional counselor in the state of Illinois and a certified employee assistance professional. So that's the experience I bring to our discussion today. There are a few things about reasonable suspicion that I want to make clear right from the start. Any drug-free workplace program is meant to be a deterrent to people, to prevent them or deter them from coming to work impaired. Drug-free workplace programs don't solve a problem. They are intended to be a deterrent to encourage people not to come to work impaired. Second, safety is the primary reason for both drug-free workplace programs and for reasonable suspicion testing. I have heard over the years someone will occasionally suggest that reasonable suspicion testing is a way to harass an employee. And that is usually said by someone who doesn't really understand the complexity and the intensity of a reasonable suspicion testing event. If I am at a hospital, if I'm on a construction site, if I'm at a grocery store or in any workplace, a financial institution, and I have to send someone for a reasonable suspicion drug test, the amount of time and effort it takes to coordinate all the activities related to that is enormous. It's too expensive for an employer to allow anybody in leadership to misuse this process. To have someone document, to escort the person to the collection site, to be with the person at the collection site, to take the person from the collection site, get them to their home safely and effectively. All of those things require a lot of time and a lot of energy and a lot of resources. And so this is never something, in my experience, this has never been something that people do willy-nilly or just to harass someone. If someone thinks that, they don't really understand the complexity of this process. The other thing I want to say about reasonable suspicion drug testing is it does not require certainty. Often supervisors will avoid doing a reasonable suspicion test because they were not, quote unquote, absolutely positive that the person was impaired. Please let go of certainty. In most of life, there isn't certainty. So just the fact that you think someone is impaired is probably not common for you with regard to that person. So when that happens, um, pay attention because it's not what you know is their normal behavior. I also just again want to acknowledge the fact that doing reasonable suspicion testing is emotionally and cognitively difficult, both for the person requiring the test and for the person subject to testing. So it's important to acknowledge that because it's a stressful kind of event for everybody. Because this is an abbreviated session, as I've mentioned, we will not have an extensive review of the most common drugs of abuse and signs and symptoms of their associated with each of the drugs. We'll discuss some of the general statistics related to alcohol and drug use and discuss briefly alcohol, marijuana, and opiates. As I've mentioned, we have compiled a list of the most common signs and symptoms of impairment and withdrawal for your consideration. It's important to note that different drugs affect different people in different ways. Some people respond, some people will get really happy when they've been drinking or using drugs. Some people will get really angry. Everyone has a different response. Everyone has a different reaction to the various drugs of abuse. And, there is evidence there's a genetic link associated with the development of substance use disorder or addiction. However, a family history of someone's family history of addiction does not necessarily determine someone is going to develop an addictive problem. Knowing your family history can be helpful as you consider your drug and alcohol use behavior. The consequences of substance use disorders touch every aspect of our lives on a nearly daily basis. The economic impact of the use of illicit drugs, the use, misuse, and abuse and addiction to alcohol costs our economy hundreds of billions of dollars every year. Despite the common myth that people who have a drug or alcohol problem are on skid row or don't work, the truth is that 75% of the people with a substance abuse problem or substance use disorder are employed, and many of them work for companies or organizations like yours. We know that employees who seek assistance with the substance use disorder will, after beginning a program of recovery, use fewer healthcare resources or benefits, miss fewer days of work, People with a substance use disorder do have relapses or slips. It's important to remember that's part of this disease. But we also know from research that people who are in recovery from addiction relapse less often than someone who has diabetes or heart disease. So it's a health condition that is treatable, that people can get better from, and it's important to acknowledge that. Marijuana is one of the two most used drugs in the United States, and that is definitely not going to change. If anything, it may become the number one. This is the case, even though marijuana is still considered illegal and a Schedule I drug at the federal level. Medical marijuana is legal in 39 states and the District of Columbia, as well as 4 territories. 23 states, along with Washington, D.C. and Guam, have acted to legalize recreational marijuana. It's estimated that just under 30% of the people who use marijuana will develop a marijuana use disorder. That's a higher statistic than I've seen in actually a recent report by the state of Illinois. But it is, one of the things we do know is that the younger people start to use, the greater their risk of developing a marijuana use disorder or a cannabis use disorder, or CUD, cannabis use disorder. And the other reality is, back in the 70s, when some of us in my age bracket might have done our field research on marijuana, it was 1 to 3% THC. Marijuana today, depending on where you get it and what kind you're using, or excuse me, the form you're using, can have a THC level of anywhere from 20 to better than 85%. So it's a dramatically different chemical now than it used to be 10, 20, and 30 years ago. Another drug that is getting a lot of attention now is opiates. Recent reports indicate that about 107,000 people died of a drug overdose last year. About 70,000 of those people were, their drug overdose was related to the misuse or abuse of opiates. Alcohol is our nation's biggest drug problem. As I mentioned, about 107,000 people died of a drug overdose last year. Last year, about 140,000 people died from the effects of alcohol, and that is the average or typical death rate for alcohol-related causes in this country. About 1 in 10 Americans over the age of 12 will have or will develop an alcohol use disorder. Over half of the people in this country, almost 60% of the people in this country, increased their use of alcohol during the COVID-19 lockdowns. Our bodies adapt to the use of alcohol. And so if we've all known people who brag about how much they can drink. So in reality, if you're bragging about how much you're drinking, or how much you can drink without having an effect, that means your body is adapting to the use of alcohol, and you may be potentially developing a little bit of an abuse issue. In our country, in the United States, the standard drink contains about a half an ounce of pure alcohol or ethanol, an amount found in a 12-ounce can of beer. A typical 12-ounce can of beer, a 5-ounce glass of wine, or a shot and a half of hard liquor, or 40 proof, or 40% alcohol, or 80 proof liquor. It takes most people in good health. If your liver's in good health, you're in good health, your body will process the alcohol in a single drink in about 1 hour. Although the incidence of drunk driving in the United States has gone down over the last many years, alcohol-related car accidents still claim more than 11,000 lives in 2020. Regrettably, it's not uncommon for someone who has a DUI in the past to be arrested a second, third, or fourth time for DUI, or for that person to be involved in a fatal motor vehicle accident. The average blood alcohol level for someone involved in a fatal motor vehicle accident is 1.7, which is twice the 0.08, more than twice the 0.08 that is considered to be drunk driving. And quite frankly, one of the things that's true, and we'll talk about this as we talk briefly about marijuana, is that alcohol is the nice thing about alcohol is we know that at 0.02, your body will have a certain reaction to alcohol. At 0.04, a different set of reactions will occur. At 0.08, for most people, they're considered legally drunk. With marijuana, we don't have access to that kind of measurement where we can determine really clearly when someone's impaired. Moderate, binge, and heavy drinking are the different categories of drinking established by the National Institute on Drug Abuse, or NIDA. Binge drinking is drinking 4 or more drinks for women or 5 or more drinks for men in a 2-hour time frame. And again, that kind of drinking increased during COVID. About 45% of the people, as you can see from this slide, 45% of the people who drink are binge drinkers. And heavy drinkers represent just more than 10% of the people who drink. And heavy drinkers are people who drink 5 or more drinks for men on 5 or more occasions in a 30-day period. So one of the things that is true about marijuana is that it is an amazing drug. It is an amazing plant that has been around and used medically and recreationally as far back as ancient Egypt. So for thousands of years, marijuana has been a part of our culture. In the United States during World War II, marijuana was grown in many parts of the country and used to make rope, which is why you may in some farm fields see marijuana growing in the ditches, because it was part of the crops many years ago. When we talk about marijuana now, it's often about the psychoactive substance delta-9 tetrahydrocannabinol, but there's much more to marijuana than just delta-9 THC. The plant contains over 500 different compounds. There are more than 100 different cannabinoids in marijuana. And as I mentioned, with modern growing techniques, people who grow it now, who develop it now, are developing stronger and stronger strains of marijuana. Historically, the balance of CBD and THC were equal in marijuana, and now that's changed. And so you have marijuana that you can buy in the stores that has a much higher concentration of THC than historically present, and the CBD levels are lower than historically present. So what's called the entourage effect, where both of these substances work together to provide an impact, that has been somewhat diminished or altered by the fact that it's grown in such a different way now and it's so much more potent in terms of the THC. CBD is available in drugstores. It's available in your gas station. It's available in a lot of places. And what sometimes happens is people will say, when they test positive on a drug test, oh, I just use CBD because it helps with my knee pain or my back pain, or it helps me sleep at night. And what's typically happening, because CBD is not regulated in any way, when you're buying CBD at the gas station, you might be getting something a product that contains a whole lot of CBD and maybe some THC, or you might be getting a product that contains no CBD. And so if you're interested in using CBD for medical purposes, please go someplace where they test the CBDs they sell. So go to a dispensary and buy a good quality, forgive me for saying this, but buy good quality CBD that's been lab tested, so that you know you're getting a real product and the product you're buying doesn't contain THC. Research on the effectiveness of marijuana as a medical intervention is limited because of our historical, the way we've treated marijuana historically, but there's a lot of research taking place now. We know that marijuana, as I mentioned, is made up of 100 different cannabinoids. The body has a cannabinoid receptor system. So there's a lot of potential for marijuana, whether it's CBD or CBN or CBA or the different cannabinoids. There's a lot of potential for these chemicals to be useful medically. We just don't have as much information as we need right now. So this is one of the things I think is really important for people to understand. This research was funded by the National Highway Transportation Administration and published in 2017. And the point they made in this study is that while THC is detectable in the blood within minutes, if not seconds, of being used, the impairment caused by CBD or THC is not apparent for up to 60 to 90 minutes after the person smokes or uses the drug. By the time the impairment shows up by virtue of the person's workplace behavior or performance, the detectable level of marijuana in that person's body has declined by as much as 80%. There's an inverse relationship between the detection of THC and the impairment caused by THC. This inverse relationship makes the job of a supervisor dealing with somebody who might be using marijuana even more complicated than you wish it were. So again, if I use marijuana, can maybe, and actually there was one state where they wanted to make it illegal. So if I'm a manager or supervisor and I'm walking to my workplace and I see one of my employees smoking a joint in their car, um, one state actually wanted to make it against the law for me to take action with that employee, even though I saw them using marijuana in their car, which obviously is kind of crazy because, again, I might smoke it, I might walk in, I seem normal, I look normal, everything looks fine, but 60 to 90 minutes later, I'm high. And so the impact in the workplace is there because of that impairment. It takes time for eating marijuana to have an effect. It's not uncommon. And I think in the paper over the weekend, the state of Illinois just issued a report where they looked at um, kids and adults going to hospitals because of their overdose, quote unquote, overdosing on marijuana. And what really happens is someone might use, someone who's a naive user might take an edible, eat an edible, and they wait a few minutes or 20 minutes and nothing happens. So they think, well, that didn't do anything. So I'm going to have another one. And they eat it and wait another 10 minutes and nothing happens. They're like, they take a third one. Well, by the time they've taken the third one and waited 20 minutes, now they've been hit in the side of the head with a mallet because the effect kicks in. And the thing to understand about when you eat marijuana, whether in whatever form you eat it, whether a brownie or an edible, gummy or whatever it is, the liver converts THC to 11-hydroxy THC, which is a more potent substance. And so, by the time it kicks in, it's really, the effect is much greater than someone might have expected. So I think if I remember correctly from the state's report this weekend, the incidence of people showing up kind of because they in a hospital ER because they've eaten too much has gone up by 500%, 5 times for kids and doubled for adults. And again, that's most commonly kids, they see the edible and they don't realize that the gummy is not a gummy. They think it's candy and they eat a gummy that's meant to be split into 4 pieces and they eat the whole thing, or they eat a bag of, something that looks like Skittles. One of the problems with a lot of the edibles is they're packaged and the packaging looks like candy packaging, which is really just, I think, terrible, but that's my opinion. Opiates have been in the news quite a bit over the last 10 years or more. Books, articles. Beth Macy has written a book about this. There's a lot of great books about the opiate epidemic in our nation. And we've really struggled with this, but we've struggled with opiates over the years. Back in the 70s, when the soldiers were coming back from Vietnam, they had been introduced to heroin in Vietnam. Many of the ones who came back, once they were out of the setting of the combat setting, they stopped using, but for others, they continue to have an opiate problem. So as a nation, we've gone through cycles of opiate addiction over time. Same thing with amphetamine addiction. We've had cycles back in the early 80s when I started working in the addictions treatment field. We had people who were using coke, crack frequently and a lot. That diminished over time. Opiates rose up, but now we're seeing methamphetamines come back into the scene. So, we go through these cycles. I'd like to remind you that if you have opiates or other narcotics that you've been given by your physician, please make sure that you store them in a secure location. This is particularly true if you have young people in your home whose friends come over to visit. And quite frankly, anybody. I know that there have been a couple of articles in some of the medical journals about doctors who have a problem going to other doctors' homes and taking the medication out of their medicine cabinets. So this is particularly true if, so I'm not saying that you shouldn't trust people that you invite into your home, but as you can see from this slide, It's if someone has an opiate addiction, they would think nothing of coming into your home and going through your medicine cabinet to see if there's anything you have in your medicine cabinet they could use. So when you and you can see in the red box in this slide that a substantial portion of the people who are getting these are getting them by taking them from friends or family. So when you no longer need these medications, please consider disposing of them. Often the local pharmacies will have medication disposal containers that you can drop these into. And then the Drug Enforcement Administration has turn-in days a couple times a year where you can turn in your medications. Just really quick about drug testing. Quest Diagnostic Laboratories is one of the labs in the country that does a lot of drug testing. The positivity rates have been climbing for the last several years. While the positive rates for marijuana in the federally mandated testing programs have declined, there has been a steady increase in the positive testing rate for the general population or the non-regulated workforce. One of the numbers that I pay attention to the most is the post-accident positivity rate. When drug testing started in the late 80s and early 90s, one of the drivers of workplace drug testing was workers' compensation costs. That was a driver. I mean, there were a couple of drivers, but that was one of the big ones is companies were just being whacked with high workers' compensation claims. And then when they investigated, they could tell that there was impairment associated with the incidents that were leading to the claims. So my suspicion is as the use increases, the probability of workplace impairment will likely increase, and we will once again have a negative impact on workers' comp and insurance costs because of illicit drug and alcohol use. When workplace drug testing initially began in the 1980s, the positivity rate was nearly 14%. It has declined steadily over the years, and only in the last couple of years started to climb again. Again, we still remain dramatically below where we were 10, 15 years ago, 20 years ago when this all started. But we're seeing a little bit of an upward trend. And again, it's cyclical with regard to what drugs people are testing positive for. This final drug testing slide breaks out the positive rates by industry. You can see that the hospitality industry, the first set of bars, has a high rate, as does the retail trades, which is more further to the right. Healthcare, the sixth set of bars, is a little higher than average, and construction trades are a bit lower than healthcare, but they're still higher, just above average. All the categories except mining have been trending higher, and I think it's curious that mining has been continued to trend lower until just last year, 2 years ago. Okay, so let's talk now about reasonable suspicion drug testing. This is, as I've mentioned, and I'll continue to mention, is one of the most difficult things for a supervisor to do in the workplace: confront an employee, colleague that they've worked with who they think might be impaired. They're difficult. These situations are difficult and awkward. Many people in leadership positions will avoid dealing with these issues when they arise because they feel like they're doing something to the person. And the reality is, if a person comes to work impaired, they probably have begun to develop a problem, because that's oftentimes for many people who develop a drug or alcohol problem, coming to work impaired, the job is so important to them. So coming to work impaired suggests that maybe they've lost a little bit of control of that, the ability to control they've lost control of their drug and alcohol use, and it's starting to affect areas of their lives where they just don't want it to affect those areas, but they've lost control. So if you confront them and deal with the situation at hand, two things are happening. One is that you're holding the person accountable, and you're creating a crisis that may allow that person to confront their problem, and whether it's an addiction or just an abuse problem, that crisis may cause them to change their behavior and could be a real benefit to them and potentially their family. So the next 4 slides, as I mentioned, rather than going through each of the drugs of abuse and the signs and symptoms of their use, this is a much simpler way to just say, here are some of the signs and symptoms of impairment: hangover, withdrawal from mood or mind altering chemicals. As you go through each of the list, you can imagine the substances that might cause the behavior that's listed. For example, on this slide, And let me take a drink before I say slurred speech. Um, on this slide, you can see slurred speech, unsteady gait, staggering walk, and watery eyes. These are all commonly associated with the misuse of alcohol. Someone who demonstrates irregular breathing or wearing long sleeves, those circumstances may be associated with someone who is misusing or abusing narcotics. Um, I can remember years ago, I worked for a trucking company and I was down in Indianapolis in July doing training, and an employee came in and they had the symptoms of a really bad cold or flu. And it was July in Indianapolis, and this person was wearing a thermal T-shirt and a flannel shirt in July. So it was really hot, and they seemed like they were cold. They had the symptoms of the flu. And to me, based on my life experience and the work I've done for most of my life, my immediate reaction is that person's probably misusing narcotics. And what I'm seeing are the symptoms of withdrawal from narcotics. Um, so, but I also want to just say that some of these symptoms like fatigue, drowsy, or sleepy, that may or may not be alcohol. It may just be they have a teenager at home that they were up arguing with late last night, or maybe they have a baby at home and they kept them up all night. So really what's important is you're paying attention to change. You're looking at the person you work with, the person you know, or you're familiar with, and you're seeing a change in their workplace behavior, you're seeing a change in their workplace performance, or you're seeing a change in their appearance that doesn't make sense to you, or it's sudden, or it just doesn't, it's not normal. And that change from what's normal to what is you see now is what you really need to notice and pay attention to, and take the time to assess whether this could be an indication of a potential problem and whether or not the person's in a condition where he or she can safely do their job. This slide, distorted perceptions of space and time. We know that marijuana can affect people's ability to perceive space and time. Uh, if I smoke a joint and you put me off in the corner and you leave me there for a while, my ability to judge how much time has passed will be impaired by my use of this drug. We know that from research that people's spatial perceptions are affected by the use of marijuana. So just one symptom alone. Irritability could be any number of issues, but it could be withdrawal symptoms for alcohol or some other drug. Someone who's anxious or nervous, that could be a narcotic, could be typically a more commonly something like an amphetamine. Someone who's got alcohol in their breath, that's simple, bloodshot eyes, and even for the thing with bloodshot eyes is sometimes people will think, well, that comes from smoking marijuana or maybe alcohol use. The action of the cannabinoids in your body with the CB1 and receptor and the CB2 receptors causes bloodshot eyes when you use that drug. So even if you're not smoking marijuana can cause bloodshot eyes. The hangover or the hangover impairment, it's important to recognize that people who come into work hungover represent a risk to the workplace. Some people come to work hungover and they brag about how much they drank last night and how sick they are today. Those people are not people who you can rely on to do their job safely and effectively. We also know that people who are hungover cause, and I tried to find this research yesterday, but I could not lay my hands on it. But we know that people who come to work hungover cause many accidents in the workplace. So it's not as if they're not a risk. They represent a risk to the workplace when they come in hungover, whether it's just a horrible headache, sweating, tremors, shakes, or whatever symptoms they might have. Someone who's a heavy regular amphetamine user might come to work. They're using cocaine and they're really depressed and exhausted because of their use of the amphetamine, the stimulant cocaine. Severe cramps and runny nose and chills, that could be a withdrawal from narcotics. So again, these are hangover effects from various drugs of abuse. And finally, withdrawal. As I mentioned before, if I'm a regular heavy drinker of alcohol, my body gets used to alcohol. Withdrawal from alcohol is the only drug that you can withdraw from that may potentially kill you. Withdrawal from alcohol is potentially very dangerous for someone whose health is not great. If your health is marginal, alcohol withdrawal can be very dangerous if you're a heavy regular drinker. So I might, if I'm withdrawing from alcohol, I might have tremors and shakes. I might be sweating. But all of these symptoms that I'm describing, or that you see on your screen, are symptoms that should alert a supervisor or a manager to the fact the person in front of them may not be in a condition where he or she can safely and effectively perform their duties, and it might require some action on your part. So, what is reasonable suspicion? We know that there are levels of proof as defined by the court system. And when considering whether or not to do a reasonable suspicion drug test, supervisors often think that they have to be absolutely certain and have proof beyond a reasonable doubt the person's impaired, when exactly the opposite is true. The highest level of evidence is proof beyond a reasonable doubt. The lowest level of evidence is a hunch. And according to the United States Supreme Court, reasonable suspicion is more than a hunch. Okay? Not more complicated than that. Please don't make it more complicated. When the Department of Transportation issued its regulations back in the late 80s regarding drug testing, those regulations became the de facto standard for workplace drug testing. Those regulations stated an employer's determination that reasonable suspicion exists must be based on specific, contemporaneous, articulable observations concerning the appearance, behavior, speech, or body odors of the employee. Now, I guess I'm not embarrassed to say that when I read those regulations when they first came out in '89, and I immediately looked up some of the words they used here, and I couldn't find all of them in the dictionary. Contemporaneous, I'm not sure that was there then, but I mean, this definition is a labored definition. For our purposes, the definition means that you must see the behavior, not get secondhand information or hearsay information. You must be able to describe what you've seen in a reasonable way, and it must be based on behavior, speech, or body odors of the person that you're observing. Cannot be, and I say this over and over again to people: do not diagnose, do not make an assessment, or do not offer your opinion. Don't say, I think this person has a drinking problem. Don't say, I think this person's a drug addict. None of that matters. It's only what you're focused on is workplace behavior and workplace performance. That's all. If you see um, if you see something in the workplace that causes you to be suspicious about whether someone is impaired, that's a hunch. If you then see any other indication of impairment, now you have more than a hunch. You have reasonable suspicion. Suspicious signs that could include the presence of drugs, alcohol, or paraphernalia or containers associated with drug or alcohol use. One of the contractors I worked with years ago called an employee in, was concerned about some issues she'd heard, he or she had heard from a customer. And when the contractor looked in the truck, they saw some empty beer cans. And, so there was paraphernalia, there was a clue. And obviously, the person might not have been using very good judgment. So maybe you notice the odor of marijuana or the smell of alcohol. You notice the person's taking more breaks or visiting the restroom more or too often. Any other suspicious signs could be, such as finding the employee in a place where they have no business being, could all be the next step beyond a hunch. You may notice some of the symptoms associated with the use of drugs or alcohol, which is some of the things I mentioned, including slow reaction time, difficulty coordinating their movements, someone who is sleeping or dozing off in the workplace, or showing any other signs of impairment that we've talked about. Okay. There are several ways to determine if the workplace behavior or workplace performance you are seeing represent more than a hunch and rises to the level of a reasonable suspicion. First, you're going to compare the current behavior or performance against the established pattern for that person, or the typical way that person behaves in the workplace or performs in the workplace. Does this person's behavior or performance meet the standards established by your organization? Is it typical? Does it meet the standards? And then finally, you're going to interview the person to determine whether you detect any signs or symptoms of impairment in addition to what you're seeing. Ideally, if you can, you want to ask a second manager, supervisor, foreman, or superintendent to look at the same situation that you're concerned about. Does that second person confirm or challenge your confusions? Now, having said that, I also want to say, be careful in these situations, because sometimes you'll call the second person, they'll say, oh, just let it go. And um, when that happens, you're missing out on an opportunity to make a difference. And that's maybe an opportunity you don't want to miss out on. When you have concluded you have reasonable suspicion to ask an employee to take a drug or alcohol test, use all the resources you have and get some help. Call or contact human resources or labor relations and ask for guidance or assistance if you have those departments. For those of you who I can see from the screen don't have those departments, you can contact ScreenSafe and talk to them about what you're seeing and how to proceed. I'll show you a checklist at the end of my presentation that you can use as a part of your action plan. And if some, and so you can also contact, I should mention this as well, you can contact your employee assistance or members assistance programs and describe to them what you're seeing and what's going on and ask them how you might proceed with the situation. I know that one of the people from Employee Resource Systems, or ERS All One, is on the call. And they're a great resource for you and can be a resource to help you deal with somebody who's impaired in the workplace. In some cases, if you're concerned about your safety or the safety of other people in the workplace, you may need to contact security or the local law enforcement folks to help you out or back you up. So this slide I'm going to take a few minutes with, just because there's a lot of things I want to cover here. Having a clear protocol of what is required when you're called upon to do a reasonable suspicion drug test is critical. Having a checklist is ideal. I mean, there's a book out called The Checklist Manifesto, and it talks about the importance of checklists. And I'm a huge believer in checklists because it's better to go down your checklist. Might take a little more time, feel a little awkward, but then you don't miss anything. Who do you contact for guidance or advice on how to proceed? That should be on your checklist. What documentation form should you use, and how should the incident be documented if there's no form? And ideally, again, if you don't have a form, go to our website, download the form that we have on our website, use that. And I'll show you that form in a few minutes. Have some kind of form that you can use to document. You want to know where the closest collection site is so that you can take, once you've confronted the employee and you've made clear that that you feel like it's necessary to take them for a drug or alcohol test, you know where you're going to go and there's no hesitation about what happens next. If you're not sure how to find out where the collection site is, if you use ScreenSafe, call ScreenSafe's office. They'll tell you where to go. They'll tell you what's closest to you. You need to determine how the employee will be transported from the workplace to the collection site. And then once the collection's over, how will the employee be transported back to the workplace, or how they will be transported home. Many of you who've heard me do this talk before know that one of the things I think is really critical for all of us to understand is, if my boss confronts me about being impaired at work, he or she should not send me home. I actually listened to a talk the other day where someone talked about the fact that an employee was sent to their office for a reasonable suspicion drug test. The employee drove themselves, and their blood alcohol level when they got to the collection site was 0.24, so 3 times the drunk driving limit. If you have someone who you believe is impaired, you obviously need to take them to the collection site, make sure they're transported safely. And when they leave your workplace, you need to make sure that they don't drive themselves. If you've determined that they're at risk of causing harm in your workplace, you don't want them getting in an automobile and putting innocent people on the road in harm's way. So you want to let the person know that they can't drive, that you'll arrange for transportation. You'll have an Uber take them home, or have somebody drive them home, whatever it is. And if they insist on driving themselves home, if they say, listen, I drove here myself, I'm going to drive myself home, let them know that if they insist on doing that, you have no choice but to call the local law enforcement authorities and say, I confronted Bill about being impaired at work. He insists on driving home. I'm concerned that he represents a risk on the road. And Bill's driving a 2010 Ford F-150 pickup truck, or or whatever it is, license plates 123 XYZ, and he's heading south on Kingery Road. That phone call to the police department is recorded, and it will be your proof that you made every reasonable effort to prevent that person from causing harm on the road. But more important, when you tell the employee that you're going to do that, he or she will hopefully say something unpleasant, but then consent to letting you have someone drive them home or having an Uber take them home. You just want to protect them from harming themselves. You want to protect innocent people on the road from being harmed by someone who's impaired, getting in their car and driving home. Once you've worked all that out, the person's gone for their test, they've been taken home. The next question is, who in the organization gets the test results? Where do the test results get sent? If the test is negative, what's the process for returning the person to work? Does that person then need to go for a medical evaluation because you saw something that was concerning? If they were at the workplace and they went for a test and before you sent them because their speech was slurred, they were staggering and they seemed to be unsteady, but they tested negative for drugs and alcohol, they're still concerned about their ability to do their job safely. So does your policy require that they go for a medical evaluation? If they test positive, what happens then? Are they terminated? If they're not terminated, how is the employee referred to the assistance program for an assessment and then referral for education and or treatment? And then once they've done that, what's the process for returning them back to work? Now, for those of you who work with ScreenSafe, you know that if someone does test positive, ScreenSafe notifies the person and refers them to the assistance program associated with their employer or their organization. And then the assistance program will let ScreenSafe know the person has complied with recommended assessment and treatment or education. And then ScreenSafe will facilitate the return to duty drug test and send them back or clear them for return. If you don't have us doing that, just make sure that you have a process through which people are in some kind of an organized way referred to the assistance program. The assistance program lets you know that they've done their assessment, they've complied with the recommendations, and they're ready to come back. And then you do if you're going to do a return to duty drug test, what does that look like? How is it done? And then finally, will there be follow-up testing for that person once they come back to work? Now, anybody who's DOT regulated, anybody who's regulated by federal guidelines knows that you will have to do follow-up testing on someone who comes back to work. And that will be scheduled. So, but if you're in a non-regulated workplace, will you have follow-up testing, and what will the schedule be like? And who will make the schedule? When it comes to documentation, all documentation should be focused on specific objective pieces of information about the employee's workplace behavior and workplace performance, and on some occasions, their appearance. Record only information about the workplace behavior, workplace appearance, workplace performance. Do not make any assumptions. Don't generalize. Don't say things like he always does this or she's always like that or any of those things. Just focus on what's in front of you, what you saw, and how it affected, whether it was workplace behavior, someone's appearance, or their workplace performance. Again, finally, don't diagnose. Don't say, I think this person's got a drug or alcohol problem, because if you say that to me, I think Bill's an alcoholic, or I think Bill's got a drug problem. When we go to arbitration or litigation, my attorney is going to want to know where you got your medical education. And so let's avoid all of that by just simply focusing on what you saw and documenting that very clearly. So here's a sample documentation form. Again, this is available on our website. And what I like about this form is that it has a checklist, so you can go through the front, fill out the front, what's going on, what was the initiation, is offsite medical treatment required, who was involved, who are the witnesses, did you see any substances, and then you can go through the checkbox and say, Bill's speech was slurred, his appearance was messy, his walking was unsteady, he stumbled, and so you just go through the checklist. But equally important is on the back of the form is the narrative. And again, narrative should be short and succinct and leave out any assessments or diagnosis or opinions, but specifically what you saw. Because if the arbitration or litigation takes 3 months, 6 months, or a year to come to pass, The checklist is great. It gives you some information, but the narrative will help trigger your memory and help you remember what was going on, what you saw, what were the experiences that you were having at the time of the incident. As Lucy said when we talked about this the other day, is, the documentation is your why for why you took action. This is the why for why you took action. Um, when you're going to take action, there are some things, what I refer to as barriers to taking action. Um, Again, initiating your response to a reasonable suspicion situation is difficult. So get yourself ready, be prepared for excuses. And when I say excuses, I mean your excuses. What excuses have you used in the past to not deal with a difficult situation? What excuses might you use in this situation to not deal with this? I'm too busy. This person's most of the time is okay. So get yourself ready, be ready for your excuses, and know what your excuses are so that when you start to pop them up, you can knock them out of the way and still focus on what you have to do. Some of the common excuses I've heard in the past are things like, this person's my friend. And this happens a lot where people come up together and maybe if they're a tradesperson, they've gone through the apprenticeship program and now one person's in leadership and the other person works for them. Hey, we went through the program together. It's my friend. Or maybe they work together in the same department and one person got promoted. And, there's a friendship here and that makes it more difficult. The next question people say was, what if I'm wrong? Yeah, or what if it's, or this is the boss's kid, or this is the boss's nephew, or this is the boss's girlfriend, whatever it is. Or I'm not sure what's going on. Let me focus on this a little longer to see exactly what's going on. Um, One of the things that I do hear from people is, this person's really well liked. So if I do this, people are going to be mad at me. And I don't think that's true, because if if people know that this person's got a problem and they see you ignoring it or not dealing with it, it reflects badly on you as a leader, as a supervisor or manager, that you're tolerating this bad behavior. Sometimes people will say, oh, this person's in the union and I don't want to get into a hassle with the union. Again, that's why documentation is so critically important. So these are the common excuses or reasons people use for not dealing with a problem situation. The response to these excuses should be straightforward. If your feelings weren't involved, they would be straightforward. For example, if the person that you have to confront is a longtime friend, sitting down with them and talking about being impaired at work will be difficult. It'll be awkward, it'll be uncomfortable, but there's no way around that. An alternative view is that the person's problem with drugs or alcohol has gotten so severe that they've come to work in a condition that they've put their job in jeopardy. They've put you in this awkward situation. By confronting them and addressing the situation directly, you may be able to help them get back on track and not only help them, but help their world, their family. What if I'm wrong? My response would be often, if someone says, what if I'm wrong? My response is, how often has this come up? How often have you seen this kind of change in someone's behavior? How often have you seen someone come to work and presenting symptoms that have caused you to think they might be impaired? My guess is probably not that often. And so when it does happen, you are compelled to respond. When you confront someone um, who may have a substance use problem, when it, you're doing two things. You're sending a message to everybody else on the team that you can be trusted to deal with problems. They can count on you as a leader, as a supervisor, to deal with problems when they're in the workplace. And you're holding the person accountable for their behavior. It's in many ways, it's a winning situation because you're holding the person accountable. You're helping them get to a place where they might get help. You're creating a crisis that forces them to maybe get help. But you're also sending a message to the other employees that you can be trusted to deal with problems when they come up. And in some cases, that might be just as important. When it comes time to confront the employee, take them to a private location. You want to avoid causing any undue embarrassment or humiliation. Once you've moved to a private space, let the employee know you're concerned that they're not in a condition to safely and effectively perform their duties, and you'd like to send them for a reasonable suspicion drug or alcohol test. Expect a range of reactions, no matter what the employee's reaction. Take your time, go slow, follow your policies and procedures, and go through your checklist. There are a variety of ways in which employees may respond when confronted about workplace behavior and workplace performance. Many of the common reactions are listed on this slide. Employees may become commonly, the most common reaction is people get angry and defensive. Some may deny there's a problem. Some may be completely silent, shut down. Some people may cry. Regardless of how the employee responds, your response shouldn't change. You should continue to be focused, take your time, focus on what you need to do. Sometimes an employee will say, yeah, you're right, I have a problem. I know I have a problem. I admit I have a problem. So please don't make me go for a drug test. My bias is go ahead and send them anyway, because later when you have to go back and deal with the actual situation, person's position might change. They might say, well, it wasn't that bad. I don't know what you're so concerned about. But if you have the drug test information, if you have alcohol test information, you have something that verifies your assessment. So don't allow yourself to be manipulated when someone says, I have this problem. Let me just admit that to you and don't send me for a test. Get the test done, have the information, have the data you need to support your position as you move forward. It's important to remain calm and respectful. Don't get agitated or angry. Stick to the facts. Listen carefully. Focus on the workplace behavior and workplace performance. Let the employee know that protocol is what is that you're going to follow the protocol and you're going to arrange for them to go to the collection site and take a test. And finally, do document everything you do. So when you meet with the person, after you've met with them, document your meeting and document what you discussed and document how you dealt with it. As a supervisor or a leader, you must be committed to confidentiality. The conversation about an employee's behavior performance in the workplace should be limited to the person who has a legitimate need to know. No one else should be involved in these discussions. Don't just, I work with one organization where an employee found out that she was going to be laid off in the cafeteria because she heard someone talking about it. Be committed to confidentiality. Don't talk about an impairment situation in the workplace with anyone who does not have a need to know. Sometimes employees will complain that everyone knew that I came to work impaired. And when you investigate these situations, yeah, everyone knew, because everyone knew that person had a problem. Everyone knew they came to work impaired with some regularity. So don't be surprised if someone says, hey, everyone knew that was not right. They knew. And it's like, no, they knew because you behaved in a way that conveyed that information to them. Before, during, and after your corrective action or your confrontation interview with the employee, remind yourself that you cannot control the employee's attitude, their feelings, their performance, their personal problems, or whether the job is secure or not. That's their responsibility. As the manager or supervisor, it's your responsibility to hold up a mirror for the employee so that they can get a good look at how they're behaving or performing and whether they're meeting the expectations established in the workplace. Ideally, they will respond to coaching and counseling to improve their performance, but that's also their responsibility. While there are many things you cannot control as a supervisor or manager, there are a number of things you can control. First and foremost, you can control how you approach the person and the attitude that you bring to the confrontation. Obviously, treat people in the way that you'd want to be treated if you were in a similar situation. It's very humbling to go from being the person who is in control of the situation to the person who is being confronted. So be mindful of the fact that it's a difficult situation for everybody involved. Be well prepared for your meeting. Don't go into a meeting half prepared. Know what the procedures are, know what the protocol is, know what you have to do next, and have everything ready to go. Be respectful as you present your information to the person. This is what I've seen. These are the things I'm concerned about. This is what our next step is. And then be aware of the feelings that you're having, because your feelings in the situation are really important, and acknowledge those feelings, but don't let them get in the way of dealing with the situation in a careful, thoughtful, and professional fashion. Okay. Follow-up is important. If you follow up with an employee after a reasonable suspicion test, whether it was negative or not negative, it provides an opportunity for you to offer extra support to that person, to let that person know that you're paying attention and that you're there as a resource for them. And then if there's additional problems, you're paying attention, you can pick up early and respond appropriately. Please don't ignore problems. Don't delay taking action. Don't moralize. And anyone who's heard me do this talk has heard me talk about the fact that I was at a nuclear power station in the South many years ago. I don't know if it was Mississippi or Arkansas. And someone said, I told the old boy if he went to church more often, he wouldn't have this here problem with his drinking. You can, in your heart of hearts, believe that, but don't moralize in the workplace. Focus on workplace behavior, workplace performance, and keep your commentary professional and focused on the issues at hand. Don't cover up for someone who has a problem. When you enable someone who has a problem, you're just allowing them to be sick longer. You're allowing them to get in trouble more. Excuse me. And you're sending a message to everyone else that you tolerate problem behavior. Don't give in to manipulation techniques or tactics. Don't diagnose. And as much as I've enjoyed Harry Potter, don't rely on magic to solve this problem. Take prompt action, use all of your resources, call Screensafe for help, call your members assistance program for guidance or support. Focus on use all the resources. If you're in an organization that has labor relations department or human resources department, use those departments. Document. Focus on workplace behavior and focus on workplace performance. So here's the reasonable suspicion checklist. If you'd like a copy of this, I'm not sure if we put this up on our website or not, but if you'd like a copy of it, just let us know and we'll get one to you. It's something that I think is useful for a lot of folks, particularly in frontline situations. Having said all of that, Shelby, are there any questions or comments that we need to address at this point?
We do have a question in the chat. Do you have to remind the union members of their right to representation?
It is a good idea to remind union members that they have the Weingarten right and they can have representation. It's a good idea to do that. And if they want it, to make an accommodation to permit time for their representative to either join via phone or in person. The time has to be reasonable. It can't be like, I'll be there in 4 hours. It has to be something within a more reasonable time frame. It should be addressed in your policy. But if the person declines or doesn't decline, please document the fact that the offer was made or the recognition they have a Weingarten right was made, and document that in the forms. Great question. Excellent question. Okay, with all that, I'm going to turn it over now to Lucy. Lucy Manos, our Vice President of Operations, we went through the questions that were submitted with the invitations, and she's going to go through some of those questions and answer any of the questions that come up. Lucy?
Hi, everyone. Thank you so much for joining us. As Bill said, there was a lot of questions and a lot of them were the same. And although I feel like some of them have already been addressed, I do think it's good just to kind of reiterate some of the information that was given about some of the questions that were asked, because there was a lot of the same questions. So we'll start off with the next slide. How do we address lack of training proper training, or relaying the information to other areas or contractors? For all testing programs, whether they're regulated or non-regulated, reasonable suspicion training is important. For non-regulated testing programs, we suggest at minimum 2 managers, supervisors, foremen within the company have reasonable suspicion training. There are many ways reasonable suspicion training can be accomplished: in-person training seminars, online programs, company-wide training, and many others out there. Our suggestion is to have recurring training, making sure, particularly for areas where you're having a lot of different people working, if you're getting new employees often or people are leaving, you want to make sure that people on your jobs or within your company have that reasonable suspicion training. Our suggestion is to do it at least every other year, if not every year. Each policy may be different and the requirements should be addressed within your policy. The important thing is to just make sure that you get it done. When you're dealing with regulated testing or Department of Transportation training, each modality, Federal Motor Carrier, Federal Transit Authority, Railroad, Pipeline, the U.S. Coast Guard, or Federal Aviation Authority, they each have specific training requirements that must be met, and those are within each protocol for those areas. Next slide. What happens if I do a reasonable suspicion test on the employee and I'm wrong? then you're wrong. But what happened next should be policy driven. In some cases, the person may be made whole, meaning that lost wages and benefits are paid. Some policies may require the person to be evaluated by a physician. Whatever the case is, good documentation is critical. Good documentation makes it clear as to the reasons why you decided to take that person in for a reasonable suspicion test. As Bill said, it's your why you did it. There was a reason behind it, and it's not just because you didn't like someone. Good documentation is essential if the case goes into arbitration or litigation. Sometimes it can be months or even years after an incident, and well-documented events will help you remember things more clearly, or if you don't remember exactly, you can refer to that documentation. So it's really important to make sure that things are documented, why you did it, what started it, and what were the things that made you decide to actually go forward with it. What happens if someone refuses a reasonable suspicion test? This too is policy driven. In DOT cases and many policies, it is considered a positive or a non-compliance. In others, it may be viewed as insubordination. And what happens next is policy driven. If it is treated as a positive, the person may be referred to the member and employee assistance program. If the refusal is considered insubordination, most organizations will terminate an employee for insubordination. Each of these situations should be addressed in your policy. Ultimately, there was a reason you believed someone was not able to perform their job safely, and that is why it's important to receive proper training and the documentation. Next slide. What happens if a new hire refuses to do a pre-employment test? In most cases, if the rules are followed within the state guidelines, a positive drug screen or refusal could be cause to withdraw the offer of employment. The biggest thing is to ensure that a policy is in place that meets state guidelines and that it is followed across the board and performed in a non-discriminatory manner. Every state in the US is a little different on how you can handle or what you can do with pre-employment testing. Every state allows for some type of pre-hire testing of some sort, although some states may have specific rules about pre-hire testing. Some states require that an offer letter be sent and the notification of the drug policy. Other states permit pre-hire testing to some degree or some specification. You just need to know what your state requires for your pre-hire testing. As of January 1st, 2024, California will no longer allow employers to discriminate against a potential employee for the use of cannabis unless the position applied for is a safety-sensitive job or if federal mandated testing is required. Federal mandated testing, such as DOT testing, still trumps all state laws. So if a person is part of Department of Transportation or they have to do federally mandated testing, that is going to trump any state law that you're dealing with. Can I still test for marijuana in any type of testing, meaning random, reasonable suspicion, periodic, follow-up, or post-accident? It's a tough question because it seems the marijuana laws are changing almost daily. It's important to stay up to date or contract with a third party, such as ScreenSafe, that remains current and lets you know of any changes that are coming your way in your state. Every state permits marijuana testing for safety-sensitive work, every state in the country. So even the states on the East Coast, which are very strict on how people can be tested, there all have caveats in it for safety sensitive work. Now, this isn't including the federal guidelines because, like I said, federal guidelines, you have to follow those no matter what. But such things such as construction workers, healthcare workers, police, jobs like these. Once you get into clerical support or non-safety sensitive work responsibilities, it really depends on your state laws. In Illinois, you can test for marijuana as long as it is done in a non-discriminatory way. In California, you will not be allowed to test for marijuana after January 1st of that should be 2024, unless the person is in a safety sensitive position. It's important to know what your state requires. Any federal testing, again, remains the same in any state. So if you have to do any type of Department of Transportation, you make sure that you're following the modality that you fall under. Next slide. Should my program still test for marijuana? This is a really difficult question for us to answer because there are so many variations of what is needed and where. There are many things that you need to factor into your decision. such as, do you do work that requires marijuana testing? What does your insurance require? Do your contracts mandate marijuana testing? Some jobs, because they are prevailing wage or federally or state funded, require marijuana testing. The fact that you can't tell if a person is using marijuana because there is no testing that shows impairment. We also do not have the research to back it. As Bill said, at 0.08, somebody is considered impaired with alcohol, but we have the research to back it. And even though 0.08 for me may be different than 0.08 for someone else, there's still enough research behind it for us to be able to say that this person is impaired, regardless of to what level. With marijuana, unfortunately, we just don't have that information. We just don't have enough research behind it to be able to have good information to be able to say that this person is impaired. That's where the documentation for reasonable suspicion comes into place, because at that point we're able to say these are the reasons why we thought someone was impaired or that they were not safe. Staffing issues, not being able to find employees who test negative for marijuana, particularly in states where they've legalized it. We've seen a lot of that in Illinois since they've legalized it in 2020, where places just can't find enough people to fill the jobs that they need if they continue testing for marijuana. Some employers struggle with the idea of telling someone that they cannot use marijuana at home on the weekends or take a gummy at night to sleep. These are all things that we are saying that are coming up. What is the state law requirements for marijuana testing? All of these things need to be taken into consideration when you're deciding if you should still test for marijuana. One of our clients, an industry-wide client in Illinois, which includes multiple contractors and union members, still allowed for the testing of marijuana, yet they did not deem it as a policy violation. Employers could choose to remain drug-free, and anyone working at that employer needed to be negative for marijuana. But by leaving it in the testing program and not using it as a violation of policy, employers could easily identify employees who could be sent to job sites that required it without having to go through a ton more testing. They also allowed the employees to retest, and if that test was negative, they would be allowed to go on different sites that required it. Employees understood that if they wanted to work for a contractor that remained drug-free or that included the marijuana testing, or if they wanted to work on job sites that require marijuana testing, that they have to have that negative test. And at that point, it's their loss for not testing negative. That's one approach that we've seen, and it seems to be a reasonable adaptation to their policy. But again, a lot of it is just what you can do, what the state laws are, and what you need as an employer, and what your contracts and agreements say. If marijuana is removed from a drug testing program, will they be allowed on federal or state jobs? I mean, no, ultimately no. But we don't see every state or federal funded job testing people. But on the other hand, if they do, yes, they have to be drug free, and they will not be allowed on a job site if they test positive for marijuana. So a new test would have to be done to meet and follow the necessary compliance issues for that particular job. As I talked about in the last question, the program that allows for the testing of marijuana but doesn't deem it as a violation saves time and money for contractors and the individuals that are already negative, and they can be sent directly out to those locations. How is testing going to adapt as marijuana becomes legal at the federal level in the future? Honestly, we can't answer that. There are so many variables that are going to come into play if and when that happens. It will depend on how they reschedule it. Is it going to be a Schedule 2 or a Schedule 3? How the federal regulations are going to treat marijuana. I think that will have a lot to do with it. How DOT or Department of Transportation looks at it and how they're going to handle it. I think also my personal feeling is another thing that they're kind of waiting on and looking for is some way to test for impairment of marijuana. You know, we've talked about it a lot, and we've talked about that they've been saying they're coming out with it for years, but there is just not anything out there that is FDA approved that we can say by using this test, you can tell if somebody is impaired from marijuana. Marijuana is one of the few drugs that stay in your system for an extended period of time. And there is no way I can tell you any difference as to somebody who uses just at home or if they're using while they're at work. I mean, sometimes by the levels, you can tell if they're a seriously heavy user, but the majority of our positives aren't for seriously heavy users. They kind of run in the mid-range, and those could be people that are regularly using on the weekends, or they're using to sleep at night, things like that. And so those numbers are going to be the same as somebody who's using whether they're at work or not. And we just can't differentiate that. We cannot tell you when someone used marijuana. I did something a few years ago. My daughter had a friend who was probably the biggest pothead that I ever met in my entire life. He smoked at least 10, 15 times a day. So when I tell you this, I'm not kidding that this kid was just constantly, he was a good kid, but he just was a pothead. He decided he was in his early 20s and he decided he needed to get his life together. And he came to me and he said, I'm going to quit smoking marijuana. I need to get a good job. They're going to be testing for, drugs, including marijuana. What can I do? And I asked him if he'd be willing to take a test for me every week. And I wanted to see for myself what was going to happen with this person, how long he was going to be positive for marijuana, knowing what a heavy user he was. It ended up taking him 57 days to become completely negative. What we see is about halves every week. So if somebody tests at a high level of, say, 3,000 nanograms, every week they're going to about half. So they'll be around 1,500, and then, they keep going down and down and down and down until they get to below that cutoff level. For him, it was almost 2 solid months before he tested negative. Now, somebody with a lower level obviously is going to take less time, but there's so many different things that contribute to it. That's not an exact science. People's metabolism, how their body metabolizes it has to do with things. How your body is functioning has to do. How healthy someone is, how heavy someone is. So all of those things can play a part into it, but it is something that is in there. So that person for almost 2 months' time did not smoke, but he still continued to test positive for that entire amount of time. So, like I said, there is just no good way for us to be able to answer that and to be able to say that, this person is under the influence or they're impaired right now.
Well,
Again, that's
Lucy,
where the documentation comes in that is really important to make sure that you're stating why you're doing it. What were the signs that this person was doing that made you move to that next level? And
well, Lucy,
documentation is the key there.
Lucy, what's happening with saliva testing? Because we know that saliva testing generally is more limited in scope in terms of how long after someone uses it'll detect. I know that Buzzkill Labs is coming out with on-site saliva testing. What's your opinion about saliva testing?
Saliva testing goes back about 12 to 24 hours, sometimes 48. It's not very accurate. So, again, it's kind of hard to be able to tell if somebody is impaired at that moment. And there's about a 7 to 11% error rate with saliva testing. Breath testing is something else that people are coming out with, and we have seen where it's going back 8 to 12 hours, but that hasn't been FDA approved yet. And so it's not something also that can show impairment. So again, we're still kind of in the same situation of we don't have the documentation, we don't have the data, and we don't have the research, and we don't have the testing means to be able to test somebody for marijuana and know with certainty that this person is impaired somehow. What about collection sites? I know this really doesn't have to do with um, reasonable suspicion testing, but it is a big question or a big thing that has been coming up as issues at collection sites. So since I had people's attention, I thought I'd address it a little bit. Since COVID, we have seen a spike in collection site issues with longer wait times due to shortages in staffing. With that comes new people that don't understand or know maybe all of the related protocols to each client. Some of them have shortened hours. We've seen problems with locations just closing in the middle of the day because they don't have staff and people didn't show up. And so what we're doing on our end for our clients is, if we talk to them and we're helping them set up a location, we are telling them to call before you go. Make sure they're open, make sure somebody's there. Before you even step out into your car or your vehicle to go out and do it, just to make sure that somebody is going to be there. And if they're not and you need to get your test done, you can always call us back and we can help you find a location. The other major issues that we've been seeing is the rise in cost. Since 2020, collection prices at some locations have risen as high as 60% from what they were pre-COVID. Most of our post-COVID site or most sites post-COVID are now requiring barcodes, which that is something that was new. They were kind of rolling it out before COVID happened, but it wasn't mandatory. You didn't have to do it. But since COVID, most sites are requiring that you pre-register and have that barcode when you walk in. It's a pretty simple setup. You can call our office and our office staff can do it for our clients, or you can register online. And as again, it is pretty simple to do. It takes 2 or 3 minutes for you to register yourself, but it is things that we are seeing with collection facilities. And that is all I have as far as the questions that we had. I did see a couple questions on here that I would like to jump to. In areas that have taken marijuana off their panel of tested substances, has the practice of reasonable suspicion increased? If so, what impact has that had on the employer, on the employee? I can tell you that we have not seen a spike in reasonable suspicion testing, not particularly not in our construction clients. We have seen a spike in it in some other areas, but not in construction clients, where I know that's been a big thing, with some places taking it out, some places leaving it in, depending on what state you're in. But I think it's going to be interesting, and I think it's going to be research and data that we have to kind of collect over the next few years. And like I said, I haven't seen huge jumps in anything as far as reasonable suspicion is concerned. Here's another question. Is there anything we should be looking at regarding psychedelics, mushrooms, since we will eventually have to contend with whether or not it is legalized? Bill, you want to?
Yeah, well, no, well, most of the screens that are done now don't test for, unless I'm mistaken, Luce, I don't think that it's commonly tested for hallucinogenics. So that's going to be, I mean, again, that's going to fall back onto the whole notion of doing really good documentation, focusing on workplace behavior, workplace performance, because some of when it comes to testing for psychedelics, that will be more complicated, and the labs will have to change a little bit of what they're doing to get us to the place where they can reliably test for psychedelics.
Correct. Yeah, most of the time psychedelics can be found in spinal fluid, so they actually would have to do a spinal tap for some of them to even detect them.
Yeah,
Because
and I'm
most
going to
drug tests,
guess that that's a Fourth Amendment violation of unreasonable search and seizure.
exactly. But that's what I'm saying. It's going to have to kind of move forward with the testing processes if that really becomes an issue. But as Bill said, it's going to come back to documentation. You know, what you're seeing, why you don't feel that this person is safe, and what you're doing in regards with that. Those are the questions that were on here.
So let me just end by saying, if anyone has any questions, now would be the time to ask them. Either unmute yourself and go ahead and ask them now, or please don't hesitate to reach out to myself or Lucy. We're always more than happy to answer any questions you have. I tend to post a lot of information that I see on LinkedIn. So information about, positive rates, current testing information, the recent state report on marijuana trends. Um, so if you are inclined to follow me on LinkedIn, you'll keep up to date with some of those things, because that's, I mean, there's so much changing in this world right now. It's important that we keep track of it. All right. Thanks everybody for your time and attention. We appreciate your being here today, and have a great day. Thank you.